I'm trying to shoot this video about what I look for at handoff. TacticalPanda had one of the commenters had posted a question like, what do I look for at handoff? How do I plan my day? How do I organize my day? I had a couple questions. This video is specifically dealing with what I look for at handoff. It's a difficult question because every nurse is different. Every unit's different. Every patient's different. It's different when you're coming off night shift or you're coming off day shift. It's going to be different. It's going to be different when you're coming on day shift and you're coming on night shift. So, it can be the same two nurses. You got 4 different points of view there. It's going to be very intense in that sense. So that's why it's been a difficult video for me to shoot. I probably shot this like 5-6 times already. And I'm trying to get the right combination. That's why I'm giving this a little preamble. I always give preambles. I have my own SBAR, okay? I do it because my feedback from my preceptor back in the day was I fool around too much. I just ramble too much. Keep on the body systems, get through it, and then go into the details. And that's my suggestion to you. Handoff is really a foundational skill that nurses aren't trained enough on. It's your last skill, usually, that you master as a new nurse. You're gonna have to know charting, you have to know med pass. Don't get me wrong. I'm not saying that any of the other skills are unimportant. That's not what I'm saying. I'm saying handoff is usually the last one. We typically can tell, okay, there's still a new nurse. Because handoff, either they rush through it, they forget things, or they dwell on things too much. So you're like, wait a minute, those are two. Yeah, you have to find the right sweet zone to be able to really do handoff on a consistent basis. Now, either end doesn't mean you're good or bad or experienced or not experienced nurse. One of the more experienced nurses I know, I think she's 20 plus years. Good God Almighty, she does 10 to 15 minutes each patient. People cry when they find out she's the one they're getting handoff from or have to give to. Either way, on or off, you're talking 10, 15 minutes each patient. A lot of people have just been outright called her out and said, no, I'm doing it this way, yeah, we're moving on. You want to stick with this patient? That's fine, I'm moving to the next patient. It's very blunt with her. So, experienced nurse, and a great nurse, by the way. One of the better nurses I know, but she kills about almost 2 hours of your day on and off. Out of the 12-hour day, that's significant. If it was just 20 minutes on, 20 minutes, 40 minutes, that's okay, whatever, right? That's a lot of time. Hour on, hour off, basically. So, and I know very experienced nurses like her, very good nurses too. They're like, guy, yeah, there's a guy in that room. They're very quick and they're like done in 30 seconds. So neither end of the spectrum denotes your abilities. I'm just saying, as nurses, we can see newbies though, because they report a certain way, even though it kind of mimics one way or the other. It's again, this is a very complicated topic, and it sounds a little ironic or oxymoronic, however you want to say, when you're on 2 different ends of the spectrum and you can still denote the same thing, So during handoff, you want to know changes. That's first and foremost. You want to get to that point. I'm not even going to get into how to get better at handoff. You just got to kind of learn. That's why I say I'm not going to touch on that subject. But what you want to look for always is changes. And usually the quickest route to that is I's and O's. All right. And you're going to cover some of that when you go through the systems. Renal, respiratory, even cardiac. You're going to go over labs and you can go over that stuff. But really, usually at the end is where I denote that. Sometimes people stop me in the middle. Say, I want to know their. I say, I'm going to get to it. Just telling you all this stuff. They got a Foley. It's MD driven. It's for wound care. It's not for retention. It's outputting this, whatever. Then at the end, I'll say, okay, these are the changes I've seen though. It was outputting clear, and fine, and this whatever volume. Now it's outputting a little hazy, and there's a foul smell to it, and output is dropped. Whatever you want to say. Maybe you just or vice versa. You've seen it was cloudy with clots and whatever. Now it's clear. Now it's too clear. It's too hazy. It's too cloudy. You're going to give that kind of change. Urine is a good indirect output measure of cardiac output. You're going to learn all this stuff. That's why it's really important that we know what the output of the patient is, whether it's something or nothing. And patients are like, I don't want to tell you what I pooped. I don't want to know what you pooped. That's why I'd rather clean the patient than rather than go to the bathroom and flush it away. And I say, no, I'd like to take a look at it. Flush. Too bad. I've had patients do that. And, it's like, torturous sometimes because how are we going to get our information then? It's difficult, but changes are what you're looking for. Changes of mentation, by symmetry. Are they all of a sudden weaker on one side? Are they favoring one side or the other? You're looking for that kind of stuff. Any pains. So any changes, first and foremost, you want to know, good or bad. Because there are certain things that through the resolution of this, you're like, wait a minute. Sometimes good, usually good. But there's sometimes bad things that you're like, wait a minute, well I'm expecting this to hurt. Why does it not hurt? Oh, I don't feel a thing. That's not good either, So it's like, whoa. Loss of sensation is not good, So you want to know changes regardless. On top of that, you want to know anything that's off record. It's like, oh, they have a visitor restriction. They don't know their son died. The point of contact or power attorney does not want them to know yet. It's sad. And I had a discussion with my girlfriend, and she's like, "Oh, you're not supposed to hide things from the patient." I was like, "If they're alert and oriented and they ask a question, they're gonna get it. No problem. But if I have express instructions from the provider or their power attorney that says no." It's not up for me to make that decision. It's not up for you to make that call. It's the provider and whoever is making the decisions. It's just like if you're in peds and you decide to, you're not going to go against the parents' wishes. They control care, whether you like it or not. And sometimes it's very sad. Sometimes. Another reason why I don't go into peds. I don't go to peds. You can go to peds. It's a lovely field. It's not cut out for me. Ironically, since I'm wearing that. But that's the thing. I always thought I was going to go to peds. And then I'm like, oh, wow, this is real sad shit. No. But you have to know what's off record, basically. It's usually noted somewhere. But, I like to get the story behind that. It's like, why? What's the deal with this? They're like, this is the story, backstory, and what have you. So you need to tread carefully, say the right things or not say the right things, right? So you want to know what's off of record. Probably the last thing I want to know in handoffs is what's upcoming. Even if it's in the record, but sometimes it's not, or it's not stated, and they might be like, okay, they're going for a procedure to MPO after midnight. Yeah. I see all that in the orders, and I don't stop the nurse. I don't believe in interrupting the nurse unless they're really going down a rabbit hole, because I want them to finish and do their thing. Because a lot of times people interrupt me, and it's like the next thing I'm going to say, or I'm going to say it at the end and tie everything together. I'm just getting through the systems. I find if you let people go through the systems really quick and then go back and say, okay, any questions? Yes. On the renal, you said this, or on the respiratory, you said the vent setting was this and tidal volumes that, and I'm seeing it's 420, not 340. Stuff like that, stupid shit like that. But I let them do the spiel first. But you want to, at the end, make sure you go over anything. There's, say, okay, yeah, it's they're going for plasmapheresis. They're going here at 12 o'clock. But They might go at 9, depending on what the lab is saying. And that's the things you want to know. The patient really wants to go at 10 because they want to get the hell out of here by the end of the day because their daughter's getting married tomorrow. Stuff like that, So it's a little bit more in depth at times. You want to know a little bit more so that way you're not chasing it later on. The patient's like, I told the nurse, I told the doctor, yes, I told her I want to do this. I'm going to sign out AMA. They always can, but patient safety, patient health, you don't want them to. You want them to get their procedures done. They want them to do things. But for some people, attending that wedding is more important than their lives. Literally, I've had a number of patients say, no, if I miss that, then what's the point of living? And I'm like, okay, calm down. You got to talk them back to earth and say, okay, look, let's try to get this happen. And I've had situations where people just, they sign out. They say, no, I'm going on this trip. You might pop a vessel up there in the plane. I said, hope they made it. Nothing I can do about that. Nothing you can do about that. But you want to know and you want to be forewarned, is forearmed, so that you can then fight those fights and try to convince them and try to adapt. Because in the end, we're just nurses. We're here to, carry out orders. Okay? Let me see if this one sticks. All right, if that didn't answer your question, Tactical, or you have something more in depth that you were looking for, shoot me another question. No problem. I love answering questions. I just like to answer them correctly or as best as I can. Sorry if it takes a while. I think he or she had a question. I took like 2 months last time to answer them. Hopefully, I think it's just been a week since my last video. Hopefully this helps. And again, it's a real deep rabbit hole. So there's so many branches to this. I'm just trying to narrow it into something general. If you have something specific, like, hey, I'm going for ortho, and I want to know what to look for. Well, pedal pulses, you want to know, rubor, poikilothermia, all that. You want to know that sensation. So there's different things. It's something very rarely I would come across as a neuro or pulmonary nurse, but there have been times I've had ortho, or I was like, hey, there's something wrong. You want to look for compartment syndrome is basically what I'm getting at. So it all depends on what the question really was motivated. I don't know, but let me just finish it on this note that it is a real fundamental skill nurses need to master. That one 20+ year nurse never mastered it very well, but in the sense of being timely. But is she a great nurse? And am I confident the patients I get from her are well taken care of on her shift, or vice versa? When I hand them off, she's going to take care of them? Yes, because she's very diligent. She's very careful. She crosses her T's and dots her I's. She's doing that. She's just dragging you along for a ride at Handoff. But that is very good. You want that person to be taking care of your patients or your loved ones, right? It's funny. My daughter's boyfriend asked me a question. She's like, "Oh, I wonder if you or your daughter would take care of me. If I would like it." And I was like, "Daughter's ICU nurse. It would be great. She's very objectively and technically sound. If you're really in trouble, yes, I would go with her." If you're on the mend and you're stable, or whatever, but you want a nurse that cares for you and caters to you, that's me. Because I put the time. Different flavors, different people. All right, different handoffs. People are going to look for different things. I tend to look for everything anyway. It doesn't matter because I come in so early. But every handoff is going to be different, and that's the difficulty of mastering the skill. People do not realize. I put it like the third skill, basically, where you need to, in importance. I keep a mental note with importance. You need to know patient safety first and foremost, and that covers a lot of things, right? Then you need to have patient interaction, in my opinion. You have to really talk with the patient or interact with them, or know if they're intubated, sedated. Yeah, you're just looking for baseline stuff, and you want to know the family or whatever, or they still show changes, and you got to be able to pick up on that. It's very subtle changes. But the third thing is interaction between nurse to nurse. You know, you want to know what the oncoming nurse or the outgoing nurse can give you. Those are skills. IV skills, med pass, all that, they're important, but they're, in my opinion, further down in importance. I'm sorry. It's not to say patient safety, correct med pass is not important. That's, like I said, patient safety is first. But nurse to nurse interaction is very important. You're going to do it twice a shift, like I said, every shift. It is something you are gauged on. You're going to be measured on. And, you know, it's important to get it right. And to get it right from somebody. You know, ask the right questions. It's not just it's not just giving the right answers. It's asking the right answers. And I've had, you know, the good preceptors, when I'm giving a report, they'll teach their preceptees that, like, did you ask about this? Did you know? You know, they weren't paying attention. I did tell them. I'm like, hey, I told them. They're like, oh, okay, good. Yeah, so you're off over there. But that's a good preceptor. Ask, you know, teaching the preceptee what to ask for, you know, what to concentrate on, especially if this patient, you look at it and you're like, oh, wait, we got to watch out for that for her. We got to watch out for this for him. Or we got to plan for this. We got to follow up with the doctor. And usually I'll guide them. I was like, yeah, no, follow up on that. You know, so handoff is not as simple as people gloss over. And, you know, hopefully this video helped you guys. Okay, good luck.